I just might shed a tear. I'm not even kidding. The reason why I'm so melancholy about today's video is because this might be, there's no promises, but it might be our very last visit with Dr. Janet Memark. She's the head of Cobb and Douglas Public Health about the COVID-19 pandemic that for the last 16 months or so has turned this facility behind me, the Jim R. Miller Park Pavilion, into at first a testing center, then a mass vaccination center as well. And that effort shut down today, which marks a turning point in this long-running pandemic.
You know, I always start off with the numbers with everybody, so we're looking pretty good right now. So right now our cases from last night were 50 cases per 100,000, and so we know we were at Cobb County. We're using the 2-week rate, and under 100,000 is considered low transmission. So we've been looking pretty good now for our last week or two. So that is great news when it comes to that. The other thing that we look at is those percentage rates. So the percentage positive. And we've been at 1.7% for that, and that's excellent as well. So of all the tests that are coming back, only 1.7% are coming back positive. So we're definitely going the right directions. And you might want to know about hospitalizations. Hospitalizations are looking really good too. So we're kind of at the lowest hospitalizations that we've seen in quite a long time, definitely before this surge. But I don't think we've seen it this low in quite a while. So it looks like even our biggest hospital has been in the teens for hospitalizations for COVID-19. So really good news.
So the numbers are good and we hope they stay that way, but there's always a variant to be worried about.
So we do have a couple different variants that we're concerned about. The Delta variant, which was the one that originated in the United Kingdom, the B117 variant, that is our dominant variant now. And so, and dominant strain, it actually looks like through the United States and definitely in Georgia. It's the last time I checked, it was about 80% of all the positive cases that were being sent were the Delta variant. You might be asking yourself, so why are we not having a big surge or anything like that? So the good news is that the Delta variant is receptive to the vaccine. So the COVID-19 vaccines are very, very good against the Delta variant. So that's some really good news. So, but the other side of that is some of you may have seen the new study that came out with the Cleveland Clinic, and they looked at hospitalizations from January to April, and we still got folks that are being hospitalized, and they looked at 4,300 patients, and of those, 99.75% of those patients were not fully vaccinated. So your chance of getting hospitalized is quite high if you do not get vaccinated against COVID-19. So really important information, and it continues to be an excellent vaccine right now.
Even though they did tremendous work at the mass vaccination site at the Jim R. Miller Park, the vaccination rates in Cobb County, although ahead of the state average, are below the national average, which has Dr. Memark still a little bit concerned.
Right now in the state of Georgia, we're looking at the first doses. About 42% of Georgians have received a first dose. And then with total doses, we're looking at 36% that have gotten a complete vaccination profile. The good news is for our Cobb County citizens that we are doing better than that. So we have 49% that are first dose vaccinated, and we're 43% that have complete vaccinations. Now, that's a lot of room, right? The president wants us at 70% by July 4th. That's going to be a little tough, but we still see our numbers keep going up. And so before school starts, we really urge people to make sure you get your childhood vaccinations and school vaccinations, but also that COVID-19 vaccine, which can go down to 12 years old at this point. So please get your kids vaccinated.
And it certainly has been some 16 months if you're in the healthcare industry. And for Dr. Memark and those she works with, it's something they'll never forget.
We just reflected upon that, upon the last 16 months and what it's been like. It's been a year and a half, really, that we as a nation have been dealing with COVID-19. And so we've lost a lot of people to that. So in Cobb County alone, it's almost 1,100 people that we've lost to COVID-19, and we've had so many people that have been affected. It's really hard to almost, really look back and reflect upon what's happened. We went from not knowing how this virus was transmitted and how to test for it, how to stop it, to the point now where we're shutting down Jim Miller Park as a mass vaccination site. And so it's quite incredible to be able to see a pandemic come to this point. We're not over, we're not done yet. but we really hope that we're really at the light at the end of the tunnel at this point. And so if we continue to vaccinate folks, we have seen an incredible drop in hospitalizations because we've gotten our high-risk folks vaccinated, and we need to keep getting our citizens vaccinated so that a new variant does not develop and really start taking over again.
Well, so if this is our last visit together, what does Dr. Memark take from the effort that culminated here at Jim R. Miller Park, at least for Cobb County, the mass testing, the mass vaccination, the 16 months of long effort by all the groups that were responsible for putting this on?
You know, all we can say is that we're grateful to everybody and so thankful to our staff here, public health, public safety, our National Guard that came, and our county and cities that helped us, and all of the citizens. You know, if we had not come together and done what we needed to do, I know it was confusing. It was confusing and horrible for me to come and with different recommendations for you all the time, but we all stuck together and did what we had to do. And I hope that that's what we look back upon, is that, you know, this pandemic, a once-in-a-lifetime pandemic, is one that we saw that we all came together and we were able to defeat it together. There are many countries that are still hurting right now from the pandemic, but we were able to come through because we had what we needed to do it, and that's each other.